adjourn and I give the call to the member for Indi.
Thank you, Deputy Speaker. I'm very proud to stand in this place today to acknowledge and thank all the staff, the boards and the volunteers who work in the hospitals and the health services of Indi in North East Victoria. Our hospitals and health services are so efficient. The ability of the staff, the boards and the volunteers to extract every single possible cent from our health dollar is renowned. And I'd particularly like to acknowledge the North East Health, which has recently been awarded the most efficient large regional hospital in Victoria, and say well done to the team. And I'd like to place on record the CEOs and the chairs of our hospitals. To Albury-Wodonga Health, the former CEO Susan O'Neill, currently Catherine O'Connell and Chair Lou Lieberman. Alpine Health CEO Linton Sayes and Chair Brian King. The Mansfield District Hospital CEO Marion Warren and Board Chair Rowan Swanee. Gateway Health is CEO Leonard Peardy and the Chair Catherine Upshur. North East Health Wangaratta CEO Margaret Bennett and Chair Brendan Shutt. Alexander Health Acting CEO Mark Ashcroft and Board Chair Carolyn Staley. Beechworth Health CEO Cameron Butler, Board Chair Katie Warner. Benalla Health CEO Janine Holland and Board Chair Brendan Smith. Tallangatta Health CEO Lisa Allen and Board Chair Angela Morris. Upper Murray Health and Community Services CEO Maxine Brockfield, Board Chair Sue Sullivan. Yane District Memorial Hospital CEO Dale Fraser, Board Chair Kirsten Michaels. To the Yakandanda Health CEO Annette Nuck and President Ken Jones. Indigo North Health CEO Shane Kirk and President Tony Jones. To Women's Health Goulburn North East CEO Susie Reid and Chair Chris Hazel. So to all the community health services and the hospitals, from a very welcome electorate, thank you for the work you do. I've been very proud to represent you in this place, and under my watch we have formed a local advisory group to provide advice to me and to the Victorian Government on the issues pertaining to our health services. We've run a workshop on the issues facing the future of small rural health services and made representation to both the Victorian and the Commonwealth Government following that workshop. We've taken up issues around funding, particularly of our multi-purpose services for Alpine Health and Corryong, Upper Murray Health, really big issues around the future funding under the MPS model. And I've been absolutely delighted to be their advocate in this place. We've supported the telehealth service that operates out of the Wangaratta North East Health Service, and how proud we were when the Governor-General and Lady Cosgrove came and visited Wangaratta and were able to showcase this fantastic service that works so well across North East Victoria. To the Bright Hospital, I've been absolutely delighted that under the government's election commitment, you received $150,000 to the Bright Hospital for its feasibility study. We've made enormous inroads in the area of mental health and mental health services, and I've been so proud to be part of the Parliamentary Friends of Rural Young People's Mental Health, to attend the various forums, to be a supporter and an advocate to support the work of Kerford House, and I note that carpet still needs replacing, and to be a real strong advocate for the young people in North East Victoria, particularly who have been suffering from mental health illnesses. However, the challenges aren't all over, and we've still got a lot of work to do, particularly with funding for the MPS. The particular formula that governs the MPS still needs a lot of work, and I'm really delighted that the Victorian MPSs are going to be coming to Parliament the week after next to meet with the Health Minister and continue their advocacy. We've got a lot of work to do with integrating the old services we had under Medicare Locals to the new primary health networks. So we've begun good work to do. We've got a long way to go, though, before we've actually made sure that those new primary health networks are the voice for the health services in our rural areas. One of the areas I want to bring to the attention of the House is residential aged care. With the exception of Alexander Health and Albury-Wodonga Health, all the public health services in Indi operate residential aged care facilities, and we absolutely need to make sure that they've got the funding they need to continue to do the work they need to do. So as we go to an election, I'd like to say to the health services of North East Victoria, I have been so proud to be your advocate. I look forward to continuing to be your advocate and actually doing something for the very many of our services that are operating 21st century health services in buildings that were built in the 19th and 20th century. We've got a long way to go, and I'm absolutely committed to being your advocate in this place. Thank you, Deputy
I thank
Speaker.
the member for Indi. The question